Hey everyone, Dr. Aruna Tumala from Trinergy Health and Psychiatry 2.0. Today I have Emily with me. Emily started our Psychiatry 2.0 program in January of 2022, and it has been my absolute pleasure to see her thrive and grow in this process. And I thought that today would be a good time to hear what Emily has to say about this whole experience, where she was and where she is right now, and what her goals are for her life and future. So without much delay, I'm going to pass it on to Emily. Hi, Emily.
Hello.
Welcome, and thank you so much for doing this video. I know, as you said, you found other video testimonials on my website very inspiring and helped you decide to give this new framework of mental wellness a chance, and that's one of the reasons why you're doing it. So thank you very much for that. So let's get started. So tell me the reason that you decided to work with me.
So I had been diagnosed with anxiety and depression and have been on medications for about 18 years. I was working with my therapist who recommended you and your services as a way to treat my depression and anxiety and other issues that I was having, digestive issues, skin issues, things like that, as a holistic approach to my health rather than just addressing things with different medications. And I was very interested in that approach because one of the things I would like to do is to stop taking my medications, but obviously under the supervision of a doctor and with support and guidance along the way as to how best to do that so that I can go forward in the future and not have to go back on medications if I do encounter stressful situations or other issues in my life.
Yeah, so much to unpack there. So, you for 18 years you've been on these medications, and how was that experience for you? Did it help you? Do you think it helped you?
So I think at first the medication did help. I was on antidepressants and anti-anxiety medication, and I do think to get over the initial, hurdle of my depression, they were beneficial. But over time, I started to feel like their efficacy was wearing off, and that there just had to be another way to address my health rather than taking medications every day. And I had been told that I would have to be on them for the rest of my life because I had tried to stop taking them previously and went through another depression and had to start taking them again. And at that time, I was told that I would basically be on them forever.
Yeah, I mean that is what is being taught. I mean, or in medical schools and psychiatry residency programs, and that is what these newly minted and old minted psychiatrists. That is what we do with our patients. But in reality, actually, you did not have any antidepressant deficiency. Yeah, like with almost all my patients, I actually find that it's a mind and body disease. And there were enough signals and signs that your body and mind were manifesting for if only anybody was listening to it and interpreting those signals as to what they meant. So I mean, trauma is common. There were situations that really emotionally branded you at one point in time. And that emotional branding is not just a psychological branding, it's a physiological branding as well, which is what I see with everyone. And that is why it is so important to heal the body before we start healing the mind. So that's why bringing the gut, you mentioned digestive issues, skin issues. I know you might, and in reality, what was happening is that not only were you not able to handle life stresses, that's why you tried going off of the medication, but then you had to go back on it. In fact, I would argue that what you were going through was actually a withdrawal because the underlying issues were not addressed, and the medications were just suppressing the symptoms. And again, this is something that I see. I'm able to recognize that because my perspective on all these things have changed now. So you were actually having a withdrawal. It was not really that you had another episode of depression, but also it also sounds like with all this that was being told, you did not trust yourself to handle your life in a emotionally stable way. And I know that one of the things that we saw was that your migraines were getting worse and worse. So it literally, your body and your mind both were screaming for help. That's how I saw your situation when you first started. So tell us about your experience so far.
So the experience has been really wonderful. So it first started with the elimination diet, and I've been on that for almost 100 days at this point, and I have noticed a huge improvement, not only in my day-to-day happiness, but my overall well-being. I've lost weight, my skin has cleared up, I've been able to stop taking medication for high blood pressure and for acid reflux. And as part of the holistic approach, incorporating practices like meditation have given me a lot more self-confidence and the ability to sort of observe situations in my behavior before I react to them, which is helping me emotionally just on a day-to-day basis.
Yeah, I mean, you've come a long way, right? I mean, according to the medical symptom questionnaire, every system in your body is now thriving, as opposed to, and it did not take long. But tell me, I mean, how hard was it easy or hard to make these changes, or what did you think? Especially, you're a full-time working person, and you have your responsibilities with all of that.
Yeah, so it was a pretty big shift. I basically didn't really cook much for myself before, and now I cook for myself almost every day. But I was really committed to the process, and at the point where I felt like I needed to make a change. And so I was really open to any suggestions that Dr. Tamal and Dr. Sunita had to help me. And so the elimination diet really is not as difficult as I thought it would be. I think it's sometimes easier if you think about it more as like clean eating than an elimination diet. And it just, the impact that it's had on my day-to-day mood, my energy, I'm sleeping better, with the addition of supplements that were recommended to me. And also we did blood work and genetic review, and we're able to identify some vitamin deficiencies that I've had that also have a big impact on my energy levels. And it's just made a huge difference in my day-to-day life. I'm sleeping so much better. I'm concentrating better. After only about 2 or 3 weeks, I already felt a lot more mental clarity and sharpness, and less like I had brain fog at times, and I felt less apathetic and lethargic than I did before. And those are all pretty monumental shifts in my life, and that motivated me to keep going with the diet. Even after the 100 days, I plan to keep going with the diet, just because of the positive impacts that it's had on my life.
Yeah. I mean, yes, and wow, you actually touched upon so many things. I mean, I think a big misconception that people typically have is that, these diets are going to be extreme and they're going to be hard, but really it is not. Number two, the second misconception is that it'll take forever for us to heal, and it's so hard to do all these things. Again, that's not the case. I mean, with everyone that follows our protocols with the diet and the supplements, literally it is within 2 to 3 weeks that we see your system responding for the better. And that's all it takes. It really is. I think you also touched upon a very important topic, which is that it's about the mindset, right? You were, and this is something, when you are in that state of crisis, and when you know that things are not getting better, yeah, that's a really big motivator for a lot of us. I mean, yes, but my hope, frankly, my passion is to get, especially children and young adults, before they go down this path. I hope to reach our next generation and tell them that, hey, it's not hopeless. Disease happens because the right conditions were present, and healing, it follows that healing also will happen when we provide the right conditions. So yeah, any other words of wisdom, any closing thoughts?
I just think you and your team are so helpful. You've been so warm and kind and just generous in your approach to this process, and generally genuinely concerned about helping me get better, and not just in my mind, but my whole body and well-being overall, including spirituality and confidence. And I just wanted to thank you also for everything you've done, because I really do feel like it's changed my life, and I'll be able to stop taking my medication in the next few months, and continue these practices going forward, because I know they've helped me so much. It's a lifestyle now that yes. I want to follow, yes. Not just something that I'm doing for a short period of time.
Yes, and yeah, thank you so much for saying that. But like I say repeatedly, the person that's getting the most out of this process is, I mean, really my job, it's not, I don't even like to call it as a job satisfaction. My satisfaction out of what I do, I mean, this is really, I am blessed to be able to see this transformation in people. So, but thank you so much for saying that, and it's very, very, you've made my day.
Oh, good. You've helped make all my days better, so
that is so sweet. Okay, so yes, I think you will be able to achieve your goals, and yes, I follow many of the things that I recommend to you and to all my patients. And the reason I do that is because we've been led to believe that living in a rat race, rushing from one thing to another, that is life. But in reality, that is not life. It is about being aware of ourselves, taking time to nurture our mind and body. That is what life is about. Life is about ease. Life is like a river. It's like a lazy river. We just have to flow with it. And no one should be feeling unhappy or anxious or stressed out. That is not our natural state. So yeah, and that is my wish for the world, that they come to this realization and know that it is actually very, very simple and easy to live a healthy and joyful life. Thank you so much, Emily, for your time today.
Thank you.